Tulane University says it is ramping up testing of hundreds of students and staff a day after a student who was living off campus tested positive for the new Omicron variant of COVID. It comes after several other cases are being reported here at home and across the country. Paul Dudley has more from health leaders at Tulane.
What it means is that Omicron is here.
At Tulane University Monday night, it all feels like business as usual. But there is one big difference. Over the weekend, the Omicron variant was identified from a COVID test administered to a Tulane graduate student.
This occurred last week, and testing over the weekend, which includes sequencing, confirmed that it was in fact the Omicron variant.
The university says the student is doing well and has been in isolation since first testing positive, and all close contacts have been notified. Tulane has now started testing students, faculty, and staff about 2,500 a day to ensure there isn't any further spread.
We're going to ramp that up this week through the remainder of December to see what the trends are and get a handle on this.
The university says with the variant now reported in at least 17 states, this is not surprising. The other reason they aren't shocked has to do with the testing platform they use at Tulane. The test they use gives them the ability to sequence the new variant, which means they are much more likely to detect it.
My understanding is that only 2 sites in Louisiana use this particular platform. Tulane is one of those. And so that allows us to detect almost immediately the Omicron variant in somebody whose PCR test is positive for COVID-19.
While there is a lot of unknown when it comes to Omicron, including just how harmful it can be, Tulane officials say there is no reason to panic, and if anything changes, they are prepared.
So all the sort of basic tools that are in our toolkit are being employed here, and so I remain optimistic that we'll be able to keep up with any changes.
Paul Dudley, Eyewitness News.